Hello, doctors. I am Dr. Donald Lozello of Championship Chiropractic in Las Vegas, Nevada. The Balance Air Scoring System, often abbreviated to BESS, B-E-S-S, is an orthopedic test that you can perform on your patients to check to see if they have impaired proprioception, if they have balance issues, or possibly a concussion. This test, just like all other orthopedic tests, need to be looked at in a group, not just as an individual test when we are giving a diagnosis. With this test, the patient is standing in bare feet or stocking feet, no shoes, no braces or tape or supports on their lower extremity. We want to make sure that they're standing up straight, and this test is performed in 3 positions. In each position is then repeated twice, the first time on a firm surface and the second time on a foam surface. The patient's eyes are closed while we are performing each test. The first one is the double leg stance, where the patient stands with both feet contacting the floor and their feet are close together. If you can, have the medial part of their ankles touching each other. The second position is a one-legged stance, where the patient is standing on their non-dominant leg. If they are right leg dominant, then they are standing on their left leg. And then the third position is the tandem stance, where they are standing heel to toe with the dominant leg in front of the non-dominant leg. The errors that we count during the Balance Air Scoring System include the patient opening their eyes, because remember, they have their eyes closed during this test, the patient moving their hands off their hips, the patient stumbling, falling, or stepping out of the position, the patient lifting their forefoot or their heel off the floor, the patient lifting their hips, moving their hips more than 30 degrees when they are doing the single leg stance or the tandem stance. This hip motion can be flexion, extension, or abduction. So if those errors occur, that counts as an error. And then the final one is if the patient moves out of the position and is not able to regain the proper position within 5 seconds, that is also counted as an error. So we count all of these errors for 20 seconds and we record the total. During the first part of the BESS test, the Balance Air Scoring System test, we're going to have the patient standing up straight in the double foot stance. So they're going to have their both feet on the floor, and they are going to have their feet touching each other if possible. Have the patient put the hands on the hips and close their eyes, and then we start the timer and we count the errors. And then once the 20 seconds is up, have them go ahead and relax, okay? And then we're going to go to step 2. Step 2 is the single leg stance. When we are doing the single leg stance, they stand on the non-dominant leg. So for example, if the patient is right-legged, or if their dominant leg is the right leg, then they stand on their left leg. And we have them close their eyes, hands on hips, for 20 seconds. Go ahead and go. Okay, and then the third test, and while they're doing each one, is we count the number of errors. Then the third one is the tandem stance. So if he is left leg dominant, then he puts the left leg in front. If he's right leg dominant, then he puts the right leg in front. And we have them go for 20 seconds and we count the errors. Excellent. Okay. Now this test was done on a firm surface. You will repeat all 3 steps on a foam surface because it makes it a little bit more difficult. So there's 6 steps to this test, to the Balance Air Scoring System test.